Welcome to another episode of China Update, where I provide you guys with the most up-to-date political, economic and geostrategic analysis on the world's number 2 economy. My name is Tony. Let's jump in. Okay, happy Saturday everybody. For those of you who celebrated, a very Merry Christmas to you all. I hope that you are at home with your families, wishing you all health and happiness during this holiday season. Here in China, unfortunately, many are not enjoying a particularly healthy week. China continues to grapple with what increasingly appears to be the biggest COVID outbreak the world has ever seen. Today's video will primarily examine these developments. If you get some value from today's video, please don't forget to hit the like button. It's a big help for the channel. According to a new analysis by London-based research firm Airfinity Limited, China is currently likely seeing at least 5,000 virus deaths every day. Back in late November, the same firm also projected that between 1.3 and 2.1 million people could die during this first wave. Quote, if China lifts its zero COVID policy given low vaccination and booster rates, as well as a lack of hybrid immunity. End quote. According to official records, China has seen fewer than 10 COVID deaths since the beginning of December. Early this week, Beijing's health regulator adopted a narrower definition of what would be considered a COVID death. But even with this narrow definition, only 10 deaths remains extremely unlikely. As we have seen, other death rate projections from reputable sources place the total number from this wave conservatively at around 700,000 to 1.5 million. One model, part funded by the Chinese Center for Disease Control and Prevention itself, has predicted China could have up to 1 million COVID deaths just during the reopening phase as the country dismantles its strict controls. As I've said before, this channel is not seeking to scaremonger. Of course, the vast majority of the hundreds of millions of people who catch this Omicron variant will be just fine, experiencing no symptoms or just a few days of mild discomfort like yours truly did this week. It is the vulnerable populations, the elderly, the sick, etc., who are most at risk, especially in the poorly resourced regions of the country at times and places where the hospital system is overwhelmed. So far, the major first-tier cities and provincial capitals are doing okay. However, we remember that, as Premier Li Keqiang pointed out back in 2020, approximately 600 million people in China earn less than $5 a day. It will be these folks in this invisible China that will feel the blow of these COVID waves the hardest. One gentleman viewer, who evidently enjoys using his mouth more than some of his other faculties, wrote an angry email to me earlier this week explaining that his Shanghai-based software company has half the team home sick with COVID, but they are just fine, and that as such China itself is just fine too, and that I should stop spreading groundless fear. I asked the gentleman how many of his Shanghai-based software engineers are elderly, semi-literate peasants earning less than $5 a day, and if the answer is none, then perhaps he should reflect on whether his employee body is representative of the country as a whole. He did not reply. Over the last 2 weeks, China has largely shut down its vast network of mass testing booths. People in China are now using rapid antigen tests to detect infections, and they are not obligated to report positive results. These developments as such make it near impossible to know what exactly the case numbers are currently. However, Chinese government leaks suggest that the numbers are much higher than international experts estimate. According to leaked minutes from an internal meeting of China's National Health Commission on Wednesday of this week, as many as 248 million people, or nearly 18% of the population, likely contracted the virus in the first 20 days of December. The minutes, which have not been confirmed, but which multiple international outlets, including Bloomberg and the Financial Times, have verified through sources, say that nearly 37 million people in China may have been infected with COVID-19 on a single day this week. An incredible number. If accurate, it would be almost 10 times higher than the previous daily record of about 4 million from January 2022. The National Health Commission estimates that more than half the residents of Sichuan province and the capital of Beijing have been infected, but some regions still have low numbers of cases.
They say too that the outbreak is spreading from urban centers to rural China. Chen Qin, the statistician we discussed earlier this week, who models infection growth based on analysis of online keyword searches, believes that China's current wave will peak between mid-December and late January in most cities. Meanwhile, state media this week continues to push the theme that Omicron is nothing to fear and that normalcy will return to China by the spring. Very much a keep calm and carry on approach. State media has also sought to hit back against the growing chorus of international and even some domestic voices critical of China's sudden and arguably messy U-turn on zero COVID and perceived unpreparedness for opening up after so much time was granted through zero COVID measures at such a high economic and social cost. Quote, "The best COVID fighting strategy in the world in 2020 became literally the worst in 2022, a sudden shocking about face without strategy or preparation." End quote. English language commentaries in both the state-run China Daily and CGTN this week have said that these criticisms stem from, quote, Western media bias, end quote. Hu Xijin, former chief editor of the populist Global Times newspaper, told his 25 million followers on Weibo this week that Beijing was, quote, facing an unprecedented battle, end quote, and that it was overly idealistic to expect adequate preparation. Several editorials in state-run Xinhua this week have trumpeted the wisdom of both zero COVID and the length of time it was maintained, as well as the recent policy shift and reopening. Meanwhile, Chinese financial media outlet Caixin reports yesterday that some brick-and-mortar pharmacies in China have begun providing a limited number of free fever medicines and engaging in tight rationing after receiving the directives from the authorities. For example, the outlet writes some 98 offline outlets of one pharmacy chain in the small Shanxinese city of Hanzhong, population 1 million, on Tuesday of this week, began handing out 100,000 free pills of ibuprofen to citizens who test positive for COVID. However, quote, even with each person rationed to just 4 pills in one purchase, all were snapped up by around noon Wednesday, a day earlier than previously expected, end quote. This came after the city's watchdog ordered drug retailers in the city to cap the amount of fever medicine a person can buy at one time. This was not just a singular case either. It has been observed at cities across the country, including at places like Dongguan in the southern province of Guangdong and Nanchang, the provincial capital of China's picturesque Jiangxi province. Quote, a manager at a drugstore in Zhengzhou, the capital city of central China's Henan province, told Caixin that they had to divide up a box of ibuprofen to share the medicine among numerous customers, a necessity due to tight supply. End quote. Chinese financial media outlet Yicai reports that some state-owned drug makers are now producing key drugs for treating fever, cold and cough around the clock. As we have seen this week, logistics across the country have taken a hit as many workers have become sick. However, key hubs are working hard to minimize disruptions and so far appear to be seeing more success compared to the zero COVID days of lockdowns. Shanghai, the world's biggest container port, is isolating the shipment of international goods to prevent disruptions to global exports. The port is keeping overseas vessels in a closed-loop zone, and there are backup teams and emergency plans in place. This is good, but generally speaking, currently China's soaring COVID infections are keeping people at home and causing a slump in travel and economic activity. One benchmark used is an index compiled by Bloomberg NEF based on traffic data from Baidu Inc., which shows that several mobility measures, including congestion in major cities, subway use, and the number of domestic flights, have all plummeted. Subway ridership in cities like Shanghai, Guangzhou, Shenzhen, Xi'an, and Nanjing have fallen sharply, all 80% below the level of the same period in 2019. Congestion levels in 15 major cities are 56% below levels seen in 2021. Quote, the rise in COVID-19 infection rates following the easing of mobility measures will continue to constrain economic activity in the December-January period. End quote. Okay, that is today's episode of China Update. Thank you so much everybody for watching, and for anyone who wants to go that extra mile and help keep China Update sustainable, Patreon and Buy Me a Coffee links are in the description below. Again, for those who celebrate it, I hope you're having a very Merry Christmas. Have a great holiday everybody, and I will see you all back here on Monday.